Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Breast cancers and their important surgeries. So to begin with, let's see some important terminologies. So what is tylectomy? So tylectomy, it means that there is an excision of the lump. So you excise the lump. This is known as a tylectomy. Then what is the BCS? BCS stands for the breast conservation surgery. So it is nothing but the breast conservation surgery. So it's breast conservation surgery or the WLE. This stands for the wide local excision. This is nothing but the wide local excision. So here what happens is a tumor removal with a 3D clearance. So the tumor is removed. So it is a tumor removal with a 3D clearance of, so there is a 3D clearance of 1 mm margin. So 1 mm of the margin, and this is of the normal tissue. 1 mm margin of the normal tissue. Now let's look at the other terms. Now when you look at the simple mastectomy, let's look at simple mastectomy. So simple mastectomy is nothing but it involves the palpable. So there's a palpable extent of the breast as well as the nipple areola complex. The nipple areola complex, and it also includes the overlying skin. So overlying skin is also involved. Next, we look at the extended simple mastectomy. So the extended simple mastectomy. So the extended simple mastectomy, it is basically the simple mastectomy along with the removal of level 1 axillary lymph nodes. So it also involves the level 1 axillary lymph nodes. Next we look at the skin sparing mastectomy. The skin sparing mastectomy. So in terms of the skin sparing mastectomy, the mastectomy is with a breast. So it is nothing but the mastectomy with the breast envelope preservation. So breast envelope preservation, and there is a nipple areola complex removal. So there is a nipple areola. We are writing it as NA complex removal. Then there is a skin. There is removal of the skin with the nipple areola and sparing mastectomy, along with the nipple areola sparing mastectomy. So here the mastectomy is with the breast envelope and the nipple areola complex preservation. So there's a mastectomy with the breast envelope and also the nipple areola complex preservation. Nipple areola complex preservation. Then we look at the total mastectomy. So in terms of the total mastectomy, it means that all breast tissues, it involves all the breast tissues. So total mastectomy is nothing but involvement of all the breast tissues, as well as there's involvement of the nipple areola complex. So there's presence of the nipple areola complex, and there is also the involvement of the skin. So total mastectomy means all the breast tissue, the nipple areola complex along with the skin. Now let's look at the level 1. Level 1 of the oncoplasty. So in terms of the level 1 of the oncoplasty, it is a volume displacement surgery. So volume displacement surgery. So here the tumor excision with wide margins. So there is nothing but a tumor excision. So tumor excision along with the wide margins. So tumor excisions, there is presence of the wide margins. And it is followed by, so there's a tumor excision along with wide margins. It is followed by a defect repair. So it is followed by the defective repair, and this is via the dual plane mobilization. So dual plane mobilization, and this is of the breast parenchyma. This is nothing but of the breast parenchyma, and this is to maintain the shape and the symmetry. So you maintain the shape and the symmetry. Next we look at the level 2. So the level 2, and this is going to be level 2 oncoplasty. So in the level 2 oncoplasty, it is nothing but the volume replacement surgery. So it's a volume replacement surgery, and here the skin excision and the glandular mobilization. So there is a skin excision as well as there is a glandular mobilization. There is presence of glandular mobilization. So this involves greater than 20% resection of the breast volume. So it involves greater than 20% resection. So it involves greater than 20% of the resection of nothing but the breast volume. Now we look at the important, that is the modified radical mastectomy. So in terms of the modified radical mastectomy, so here this involves the entire. So it involves the entire breast tissue, and there is also the nipple areola complex. We are writing it as NAC, along with the skin and the axillary lymph nodes. So it involves the axillary lymph nodes, that is 1 plus 2 plus 3 dissection. So there are 3 terms which are very important to know. One is the patties. The patties. So patties means the pectoralis minor is removed. So here the pectoralis minor is removed. So patty means it is removed. Then when you look at the scalons, next is the scalons. So in terms of the scalons, the pectoralis minor is incised. So the pectoralis minor, it is incised. Lastly, we see the Auchincloss. There is something known as the Auchincloss. So Auchincloss means the pectoralis minor is only retracted. So this pectoralis minor, this will remain retracted. Now we'll move on to the Halstead's radical mastectomy. So what is the Halstead's radical mastectomy? Halstead radical mastectomy. So here the entire breast tissue is involved. Entire, we're writing it as BT, that is the breast tissue, with the NAC, the nipple areola complex, plus the skin, and along with this the level of lymph nodes, that is axillary 1, 2 plus 3. So 1, 2 and 3 lymph nodes. Next is the involvement of the pectoralis major. So the pectoralis major is involved along with the minor. Then there is a extended radical urban. So next there is a extended radical So in extended radical, it is the urban. So under urban, there is Halstead. So Halstead's plus. So Halstead, we saw it was the entire breast tissue, the nipple areolar complex, the skins, the level 1, 2, 3 of the axillary lymph node, the buccal major, the minor. So along with it, it also includes the internal mammary lymph node dissection. So the internal mammary lymph node dissection, this is involved. Next, we move on to the extended radical mastectomy. So extended radical, so it is also known as the Dahl-Iverson mastectomy. So what does it involve? So it involves the Halsteads. So it involves the Halsteads. It involves the Halsteads along with the internal mammillary nodes. So it involves the Halsteads and it involves the internal mammary. Also the supraclavicular lymph nodes. So Dahl-Iverson, it includes the supraclavicular lymph node dissection as well, along with internal mammary plus the supraclavicular. So supraclavicular lymph nodes dissection. Then comes the superior radical mastectomy. So what is meant by the super radical mastectomy? So in terms of the radical mastectomy, there is something known as the Halsteads. So we saw the Halsteads along with the internal mammary. So there's internal mammary along with the supraclavicular, and the supraradical mastectomy, it also includes a mediastinal lymph node dissection. So there is mediastinal lymph node dissection as well. To learn and grow daily like this, please do subscribe.